What type of other non-drug approaches or natural remedies can be used or found helpful to treat a migraine attack or the nausea that often accompanies it?
Yeah, a lot of people want to try to stay away from medications, or maybe the medication is not enough and they need something else. So it's really important to explore what are those non drug options that can help with the pain or maybe even the nausea. Now, there are behavioral therapies, specifically biofeedback or deep controlled breathing, that can be helpful to reduce pain perception during an attack. There are also some neuromodulation devices that change the way the brain functions during an attack, trying to normalize it and stop the attack. There's currently 5 neuromodulation devices that can be used to stop an attack. And these are targeting nerves like the trigeminal nerve, the occipital nerve, the vagus nerve, as well as altering the electrical environment of brain cells with magnetic pulses. These devices include the Cephally device, the Relivion, Savvy Dual, the GammaCore device, and the Nerivio device. And these can be effective non-drug options to stop a migraine attack. Now, some of my patients will also use things like essential oils to relieve the pain, or even ginger, which can help relieve some of the nausea associated with a migraine attack. Any of these options can be used independently if that's effective, but most of my patients will use them in addition to a migraine-specific treatment option.
So many of us with migraine know that it can be easier to attempt to prevent an attack before it happens rather than tame it once it has arrived. What type of options exist to try to prevent migraine attacks without medications?
Again, a lot of people are looking for all those non-drug options, and definitely in prevention, there are multiple things that you can do to raise your threshold so that it's less likely that you're going to have a migraine attack. Some of those are lifestyle changes or management that you can do. I like to tell my patients about planting the seeds for success in migraine management. So SEEDS stands for sleep regimen or sleep consistency, eating regular healthy meals, exercising daily, avoiding dehydration, and then stress management, not stress reduction. We all have stress, difficult to control, but we can manage the way that we respond to stress. Those are some of the non-medication options that are available. There's also behavioral therapy, such as cognitive behavioral therapy, biofeedback, that are evidence-based preventive treatment options for migraine. And then some of those devices can be helpful for prevention in addition to being helpful for acute treatment. Another non-drug option for the prevention of migraine are supplements, including magnesium, coenzyme Q10, or even vitamin B2 or riboflavin. These can be effective for migraine prevention. Those are most of the non-medication options that we have to raise that threshold so that it's less likely that someone has a migraine attack.